I want to talk about the drug company you started.
CosplusDrugs.com.
Okay. Yeah. Because one of the toughest things is that people pay more. Well, first, you tell me what's the best order for this, because we talked about like the insurance, the scam that goes on between hospitals and insurers and regular people. And then can you explain that to me and then tell me how your drug helps, how the company helps?
So where we fit in all that.
Okay.
Right. Okay. So there's insurance. Well, that's the best way to explain it. There's drugs that you take, and then there's what they call providers, the hospitals you go to, right?
Okay, so the hospitals you go to is the provider.
The provider, right? And then there's the payers, which are the insurance companies, right? And the insurance companies try to do deals with the providers, but they're not always up and up, right? The provider, it's not the providers, it's just the insurance companies have all the leverage because they have the money. Right. And hospitals are just trying to get all the business that they can get. And so there's all these games and arbitrages that are played over and over and over again. But what I think people don't realize is almost everybody with healthcare, like where do you get your healthcare? Or do you just self-pay, or do you have insurance?
I have health insurance.
Through, do you know?
I'm not sure, but it costs $400 a month.
Okay. So it's probably the ACA, right? The Obamacare, right? But you have a deductible, right? And let's just say for the shits and giggles, that's $2,000 deductible. For the hospital, even though this insurance company is going to pay anything above $2,000, you're responsible for that $2,000, right? And the hospital, is already not going to get paid on 50% of the deductibles. And so that's why you get a lot of this bad debt. The insurance companies don't pay for the whole thing. And they plan everything so they don't have to pay for the whole thing. And that creates a lot of medical debt. And so there's
medical debt that the hospitals owe.
The individuals with the deductibles.
I see what you're saying.
Right, because they can't afford to pay their deductible.
Got it.
Right. And so, you have some disease and you can't afford your deductible, which is $2,000. It doesn't matter that it covers above $2,000, right? Because you can't pay the first $2,000, right? So that puts people in a lot of fucked up situations, and even hospitals, the providers in bad situations, because a big part of their revenue isn't getting paid, right? And here's the insurance company not giving a fuck. Right? They're just saying that's your problem, not mine.
Right.
Right? I'll pay you what I think I owe you, maybe. Right. And so all that, the insurance companies put pressure on the hospitals, the providers, the doctors, and the doctors then put pressure on the patients. That's where it's all fucked up. Right. And so what we're pushing for with the Harris campaign and in general is a lot of that happens because there's no transparency. Nobody knows what the contract is between the insurance company and the hospitals. Nobody knows what the contract is between the insurance company and your employer. And so as a result, the biggest companies have the most leverage and can fuck with everybody.
Yeah.
And that's where things go bad. So what I'm saying is, if you make every insurance contract and provider contract public, then all of a sudden people can understand just how
that's called Power to the Patients. You familiar with them?
Yeah.
There's a group out there called Power to the Patients that lobbies for price, that you have to know how much an MRI costs when you go to get it.
Right.
So that way, if the hospital says the MRI costs $700, then the one down the street's going to have to say it costs $650, and they're going to have to start
to compete. Right.
And they're going to have to start to compete.
Right.
And there's an executive order that says they have to do that.
Right.
And that was a good thing that Trump did, but it wasn't enforced by the Biden administration.
Well, because the penalty is only like $1,000 a day.
So they'd rather pay the penalty?
Right. And so I funded a study that had people call the hospitals to see if they can get those cash prices.
Yeah.
Right. And a lot of them didn't even know, a third of them didn't even know what the cash prices were. Right.
Wow. So they're not being instructed.
It's not, they just don't know, right? Because they don't care. That's not a big part of their business, right? They want to get all the money from the insurance companies. So anyways, circling around to what we do, right? Mm-hmm. So I got a cold email, just like Thomas the pizza guy. I got a cold email from a guy named Dr. Alex Oshmayansky. And he said that there are a lot of generic drugs that were in short supply and kids can't get their medicine and this and that. And I'm like, well, what can we do about that? And he's like, well, I want to do this thing called a compounding pharmacy where we can make those drugs, right? And so And he's like,
so he wanted to start a compounding pharmacy so you guys can make
those drugs that are in short supply. I'm like, that's cool, but it's not thinking big enough. So I'm like, let me look at the pharmaceutical industry and the drug industry and see why so many people can't afford them and what's going on. So I looked at it, and it was really obvious really fast that there's no transparency, right? Because nobody, just like you don't know when you go in, for your MRI, like doctor says, Theo, you need this medication. You have no clue what the price is going to be. The next question always, what pharmacy are you using, right? They're not saying, can you afford it or anything, right? So we decided to create this company called costplusdrugs.com. And if you go to costplusdrugs.com and put in the name of a medication, we don't have them all, we have about 2,500. We'll show you our cost, our actual cost that we actually pay for it. And then we mark it up 15%. And then there's $5 shipping and handling to send it to, and then $5 for our pharmacy. Or if you pick it up locally, it's $12. So the pharmacist makes money. And because of that transparency and only marking it up 15%, our prices are dramatically lower. And when the insurance companies are trying to rip people off, like there's a drug called imatinib. And if you don't come to us or some of the better pharmacies, smaller pharmacies, you might get charged $2,000 a month. For us, it might be $21 a month. I had a buddy who takes this drug, droxidopa, and I didn't know what the fuck it was, right? A friend of ours emailed me and said, Landon can't get this because—
Droxidopa?
Yeah, I don't know what it is. Sounds like a drug, right?
Sounds like a free safety for Alabama, too.
Yeah. And so he was like, he can't, he lost his insurance and they're going to charge him $10,000 every 3 months. I'm like—
That's crazy.
Crazy. So I'm like, let me see what we can get it for. And go ahead and go to costplusdrugs.com and put in droxidopa. And $64 for the 3 months. And yeah, you don't need to show that part. Yeah. So go to see all medications and then droxidopa. Now it's $14.
Put some Nicorette on there, dude. You
right?
Sell the lights out of it. Droxidopa, so now it's $14. So you guys, because you're able to make the drugs yourself?
No, because we're able to buy them in volume and because we only mark them up 15%.
Well, why doesn't our own government do that to help us?
Well, they're starting to now, but see, the problem was we publish our prices and we put out a price list. Before we came along, nobody else did.
So you're creating the fact that other people are now going to have to do that.
Right. So now people see our prices and they're like, okay, millions of people are just going to costplusdrugs.com, right? And the doctors are like, fuck, droxidopa, $14 instead of this other place wanted $3,000 plus a month. We're going to costplusdrugs.com.
Are all of your drugs cheaper?
I'd say 99% of them are, yeah. Every now and then there's one where we're not cheaper, but every time as our volumes go up and our prices go down, we pass it on. So literally we've lowered our prices on every weekday since last August. I guess it's been over a year now. We've lowered our prices. We've had some drug that has come in that we've been able to lower the price on.
Wow.
So anybody out there, you, your mom, your dad, your aunt, your uncle, your grandparents, right? Whatever drug you take, if you're paying, more than $15 out of pocket, go to costplusdrugs.com, put in the name of it and see if we're cheaper. I mean, literally it's crushing it.
Right. That's all it does. That's all it takes to check it out.
That's
just to go there and do it.
You just do it, right? So like if you have a deductible, we might be cheaper than your deductible and it's cheaper to pay cash with us.
Now, can people run into problems, say if they're not supposed to get certain drugs? Is it easier to get those drugs through you guys?
No. You still have to have a prescription.
Like Percocets or whatever?
No. We don't do any controlled substances at all. Yeah.
Huh. Wow, man. But how does the government allow you to be able to do that?
Well, they can't stop me. Right? Because it's just free market stuff.
Yeah.
They like it.
I'm glad that it's happening.
No, they like it, right? So now I'm talking to the Harris campaign and I'm saying, look, if we just do this transparency, you guys can buy it the same way we do, right? And so there was a thing from the FTC who went after all these things called these pharmacy benefit managers and just threw them under the bus and sued them, but they used our prices, right? Now there's research
in the lawsuit?
Yeah. Yeah, there's research from like Vanderbilt and Harvard saying if Medicare bought at our prices, they would save billions of dollars a year, right? I mean, literally immediately, if there's people out there that are struggling with their prices, what they pay, they switch to us. They're going to save a fuck ton of money.
And they can just do that, but it's their own choice. They don't need their doctor's approval to switch.
Well, they need to get a prescription to send to us.
Okay, so let's still need a prescription.
Right, you still need to get.
But the doctor doesn't determine where. They just usually say what's your local pharmacy because that's just
and you
what
just
their
tell
practice is.
Right, and so you just say, send it to costplusdrugs.com.
Yeah.
So in the system that the doctors use to create the prescription, it lists us there, and they just click on it, and it's easy.
Wow.
Yeah. No, it's insane. It's insane. Like literally, we only started January 19th of 2022. Mm-hmm. So we've only been around a little bit more than 2.5 years. And we're just changing everything.
Is it publicly traded or no?
No. It's private.
Damn.
I funded the whole thing.
Damn.
No, because I don't want to have to worry about making people money.
Yeah.
Right. Because we're losing money now. Not that much actually now. But it's more important for me to fuck things up, right? And change
so
things.
You like the fact that you're changing the industry?
Yeah.
I love that.
No, because to me, that's always the most fun, right? So you got all the healthcare industry, right? If what's the one thing you want to go down in history for? I fucked up the healthcare industry, right? I made it so people could afford their healthcare, their medication. And so, that's what we're doing with pharmaceuticals and medications. We're also working on cost plus wellness, which will deal with and kind of push out those insurance companies because most people get their healthcare through their employer. And most employers, particularly the big ones, self-insure, meaning they pay for all the cost out of pocket. And they don't realize how the employers, the CEOs of those companies, don't realize how badly they're getting ripped off. And so we're out there working on new programs now so that those employers will figure it out. We're starting with my companies, and then we'll extend it out to other companies.
Yeah, it's just crazy that I feel like it just needs overhauls of things, And
it's not that hard. This is the easiest industry I've ever disrupted because all we had to do was publish our price list.
Right.
Because everybody else was hiding everything, right? You talked before about shit happening behind the scenes.
Well, yeah, because you go into the doctor, you go into the hospital, you sign something that says, I'm going to pay whatever you want charge me.
Yeah, for sure.
And then you assume they're going to charge you the amount the fairest amount because they're a fucking hospital. They're supposed to take care of you.
You would think so, right?
And then they don't. They charge
because they want whatever they can.
But why do they do that?
Because they're getting fucked by the insurance companies.
Got it.
Right? And they know that if you complain about the price, they'll reduce it.
Right. So, but then you're already sick. Now you have to spend
Deal
the
with
next
all this.
17
It's
weeks
horrible.
of your life.
Right, dealing with that shit, right?
Arguing with someone who's been trained how to argue against you.
Exactly right. And that's
in
what we're going to
another
fuck
country
up.
most of the time. Actually, some of it's here. A lot of medical billing is here.
Yeah.
But then
if you're calling in, and it's over there. Yeah, for sure.
But then they feel horrible. Then the person arguing against you, the employee feels horrible because they know that
they're fucking you over.
They're fucking you over, but they're just trying to make their
So
money to go
from
home
the
and take care of their
hospital side of
kids.
it, right? The hospital has to have way too many employees to deal with the insurance company. And the insurance company says, okay, we know this is what we're supposed to owe from when Theo took his kid in there, right? But we're not going to pay you the full amount. If you don't like that, sue us. And then they sue them. So now they have to have a shitload of doctors, right? So what we're saying is we're going to these places and saying, we're going to do a contract. We're going to do just cash, right? So there's no fucking around with the insurance companies. And we're going to publish all of the contracts so that everybody can compare notes and figure out the best way to do it.
Yeah. Well, there was an executive order that said that they have to do that,
right?
But it's not being enforced.
Well, they do a little bit, but like we said earlier,
not at a level where it's helping, where people are like, they should have a commercial. The government should buy a commercial every week that runs 100 times that says, right now you have to. Trump administration announced historic price transparency requirements to increase competition and lower healthcare costs.
Yeah, they said so. They said I think for 100 of the most.
This was something not good that Trump did.
No, it was good. No, I'm not saying Trump did everything bad, right? But this is one of the good things he did. But yeah, this is one of the things I think back then it was 100 of the top services. Now it's 500, I think. And
so it's growing?
It's growing.
That has to do it.
Right.
But how do we enforce it that it's not being enforced?
Well, so it's not so much enforcing that, right? Because if they put up shitty prices, it doesn't matter. If you show prices that are too expensive for everybody, it doesn't matter. And so you want to be able to have the whole contract published so that everybody who's responsible for paying not only sees that price, but how it got to that price.
Right.
And then people can create software and apps and this and that can truly help you because most people do have some kind of insurance, right? Mm-hmm. Like only 11% of people don't, or they have high deductible plans. And if you have a high deductible plan, you don't quite know what you're going to end up paying out of pocket anyways, even if they tell you that it's only $750 for the MRI or $250 for the MRI, right? So that's an important part of it, but it's that much of it.
Yeah, it's just interesting. It's just tough that you have to figure out how am I getting screwed all the time.
It's brutal. But that's the opportunity for me, right? Because
the Paul Revere pills will call you,
let's
dude.
go.
Dude, that's good.